Good afternoon, Co-Chairs Winters and Williamson, members of the committee. Thank you for the opportunity to also address the ODSVS request to increase by $4 million. My name is Toni Ryan. I'm the Executive Director of the Center Against Rape and Domestic Violence, also known as CARDVA. We serve Lynn and Benton counties in Corvallis and Albany as well. I would like to tell you the story of a woman who came to us and worked with us a few months ago to really illustrate how ODSVS has an impact in our community and what it does. So this woman's name we're going to say is Jane, and she came to the shelter about 6 months ago, and she brought her 2 children. She had a teenage daughter, Nicole, along with her 5-year-old son, Talon, that after about 7 years of living with her partner, he had physically assaulted her, emotionally abused her, sexually abused her. And throughout the 7 years that they were together, it wasn't until he started emotionally abusing the children that she started thinking that she should find a way out. And it was only until it was after he started physically abusing the 5-year-old that she knew she had to change the situation. So she started talking to the teachers. She found the school teachers that she could approach, and they connected her with law enforcement and CARDVA as well. So what we know is that domestic and sexual violence are both very complex issues, that there are no simple solutions to just ending this or getting out of a situation. We're actually part of a working system that really helps establish safety in communities. And our unique role as providers is to do safety planning with individuals as well as provide a safe place to go, such as a shelter. So Jane came into the shelter, and due to the seriousness of the abuse that they had experienced, she actually got full custody of her children and was free to relocate wherever she wanted without telling her ex-partner. Those are both kind of unusual circumstances, but it was really great in her situation. So what we were able to do is help her connect with all these other services. Like, we helped her find an attorney that would work with her on a sliding scale fee. She worked with victims' assistants to find out what was going on in the court process. She used the address confidentiality program that's available by the state so that she could go into hiding but still get all of her mail. She worked with DHS, the Department of Human Services, to access the domestic violence grant to just kind of get things established, get her apartment going, as well as finding SNAP benefits to have some food stamps on the side. And then we were able to also connect her with some appropriate counseling for her children, probably through the ABC House, which is another wonderful community resource. So the process of getting safe doesn't end when she comes into shelter. That's just really barely the beginning. It's never a really simple way out. That in addition to helping her figure out just those first steps of find a safe place to live, figure out how you're going to pay for your bills, how are you going to buy food, how are you going to create some kind of normalcy for your children so that they can feel safe again, that's just really the beginning. What we need to do is we're acting like navigators. In the health system now, there's a lot of talk about navigators, and advocates have been doing that forever, that our key role is to find those resources in the community and make them easily to access for survivors. So when it came time for Jane to move on, she found an apartment in an affordable housing complex, and fortunately, that's where we have an office. We have a partnership with a housing development that CARDVA has an office on site. So she's able to continue to meet with an advocate every other week. And during that time, that she's still continuing to deal with her partner, her ex-partner, violating the restraining order, continuing to threaten the kids. He pops in and out. Even though she's in hiding, he doesn't know exactly where she's at, but he can still stalk her in many other ways. So she's still working with CARDVA in that way to also advocate and working with law enforcement, as well as the university where she's going to school to get safe. So just because a survivor leaves an abusive situation, it doesn't end there. Putting together all those logistics are just the start of it, that we really want to be able to help her ongoing. That what CARDVA can offer is that we have advocates that are well-trained in domestic violence and sexual assault, as well as providing trauma-informed care that is really unique and different than she's meeting anywhere else in the system. We're a key player in the system. So I've long believed that in addition to fire, police, and ambulance services, every community should have domestic violence, sexual assault services as one of the core emergency services. ODSVS allows us to do that, and we really would love to see this increase come through. Thank you.